60-year-old motorbike driver with road traffic accident, CT scan of the chest showing, can you see this? The black line here, the black line here in the lumen of the arch of the aorta. This is an intimal flap, a small intimal flap, and it's continuous here. So there is a small intimal flap on the undersurface of the aortic arch, with small blush of extravasation of contrast. A small blush of contrast extravasation. Can you see this and this dot and this dot? This is a small blush of contrast extravasation adjacent to this small flap. I will show you another one. This is another dot. Can you see this dot? So this small flap shows adjacent a small blush of contrast extravasation, along with minor stranding of the peri-aortic fat. Let's see the minor stranding. The stranding of the peri-aortic fat. Let's see this lesion here. The blush of contrast seen here clearly. Let's talk about the hepatic segments. How to know the hepatic segments on CT scan. The hepatic segments are divided by the portal vein into upper and lower segments, and also divided by the hepatic veins, the right and the middle and the left. Hepatic veins into right and left hepatic segments. The first hepatic segment is the caudate lobe, and it is the landmark of the upper hepatic segments. Whenever you see one, I can see 2, 4A, 8, and 7. I can't see 1. Then I will start with 3, 4B, 5, 6. Okay? So the landmarks of the upper hepatic segments is the caudate lobe. However, the landmark of the lower, okay, will be the portal vein or the kidneys or the pancreas. Okay? All of these are landmarks for the lower hepatic segments. So if you go to the CT scan, can you see the portal vein? If you are at the level of the portal vein, the level of the pancreas, the level of the kidney, this is the lower hepatic segments. And at this level, I can see the first caudate lobe. So I will start with 3, and I will use the hepatic veins. Okay, I will use the hepatic veins. Okay, so this is 3, 4B, 5, and 6. Okay, the 6th hepatic segment is close to the kidney, the right kidney. Okay, okay. Whenever you see the caudate lobe, this is the caudate lobe, and the IVC inside the liver, this is the upper hepatic segments. So I can see 1. So I will use the hepatic veins to divide the hepatic segments. Okay, so I can see 1. This is 2, and this is 4A, and this is 8, and this is 7. 1, 2, 4A, 8, 7. Again, the right and the middle and the left hepatic veins are seen here, draining into the IVC. So this is the upper hepatic segments, okay? Whenever you see the IVC inside the hepatic parenchyma, we are in the upper hepatic segments, okay? So this is 2, okay, 2, and this 4A, 8, and 7. And if you go down, 1, 2, 4, 8, 8, 7. Again, 1, 2, 4A, 8, 7. This is the level of the pancreas, kidneys, lower. These are the lower hepatic segments. 3, I will start with 3, 4B, 5, and 6. Next finding, there are multiple hepatic lacerations. Can you see this? Multiple hepatic laceration. This is a hepatic laceration extending from the liver capsule, okay, extending to a depth of 6 centimeter, a depth of 6 centimeter, and it is seen here involving the 7th hepatic segment. As we are in the upper hepatic segments, this segment is the 7th. And if you go down, you will see another hepatic laceration extending from the capsule to a depth of about 5 to 6 centimeter, okay? It is seen here involving the 6th hepatic segment. Why? Because we are in the lower hepatic segments. Can you see the kidney here? This means that we are in the lower hepatic segments, okay? And this is the 6th hepatic segment. So we have here multiple liver lacerations involving mainly the right hepatic loop is the largest, seen involving the 7th and the 6th hepatic segments, with perihepatic free fluid. Perihepatic free fluid. This is associated with perihepatic free fluid. With perisplenic free fluid. Little amount of perisplenic free fluid. So we have here perihepatic and perisplenic free fluid of high attenuation. This fluid is of high attenuation, okay? Along with the history of road traffic accident, this fluid is most likely to be perihepatic and perisplenic hematoma. This is associated with right pericolic free fluid and also pelvic free fluid. So the hematoma is extending into the pelvis and the right pericolic area. right pericolic hematoma and pelvic hematoma. Next finding, in any case of road traffic accident and pneumothorax and pleural effusion, okay, and the pleural effusion or haemothorax, this patient has pneumothorax and haemothorax. This patient has, as you know, pneumothorax and haemothorax. So you need to look for rib fracture, as the rib fracture is the reason of the lung injury. So you need to inspect the ribs very carefully, okay? And I will show you how to look for rib fractures. Starting from the neck, the first rib will appear here is the first rib, okay? So this is the first rib. So let's see the first rib of the other. The first rib is normal here on the right side. The second rib will appear, okay? Let's see the second rib here. The second rib is normal, okay? Then the third rib, let's see the third rib here. The third rib here is fractured. The third rib is fractured. So next rib is the fourth. So this is the fourth rib. Let's see the fourth rib on the right side. The fourth rib here is fractured. Okay. Next rib is the fifth. This is the fifth rib. Let's see the fifth rib on the right side. The fifth rib is also fractured. Fifth rib is also fractured. Okay. Okay. Then the sixth rib. The sixth rib here is normal. Let's see. Yeah, the sixth rib here is fractured. Can you see it? It's fractured here. Fractured right sixth rib. Okay. Then the seventh rib. The seventh rib here is normal. The seventh rib here is also fractured. Okay. Next rib is the eighth rib. The eighth rib is normal here. Then ninth rib. Ninth rib is fractured here. Can you see it? This is the ninth rib. Okay. Tenth rib. Okay. Tenth rib is normal. This is the 11th rib. Is normal. Then the last rib. This is the last rib. This is normal. Then no more ribs with the start of the lumbar vertebrae. So the interpretation here, this patient had a road traffic accident and the CT scan showed tear in the aortic arch along with apical pneumothorax. Can you see this air? And here, the air here, this is apical pneumothorax, okay, and the bilateral pleural effusion of high density, along with the history of trauma, This bilateral pleural effusion is most likely to be bilateral hemithorax. And can you see this sign? Comet tail sign. Comet tail sign. I can see vertical linear opacities are seen pulled into a collapsed lung parenchyma. Can you see this white part? This is a collapsed lung parenchyma with pulling of the adjacent bronchovascular bundle into it. This is called comet tail sign of atelectasis. Okay, so here there are bibasal atelectasis. Whenever you see a patient with history of trauma with pneumothorax and bilateral hemithorax, you need to look for the cause of the lung injury, which proved here to be multiple rib fractures, as I mentioned. Okay, so the rib fractures is the cause of the lung injury in the form of pneumothorax and bilateral hemithorax. This patient also has multiple liver lacerations. Okay, so this is the interpretation and this is also the diagnosis. Regarding the management of this patient, okay, for the hepatic lacerations, this patient needs urgent abdominal surgical referral. And for the aortic arch tear, this patient needs urgent vascular referral. That's it.